What's up, y'all? It's Celeste, and it's been almost a month since I made a video, which is kind of long for me, and I definitely didn't mean for that to happen. I actually intended to make an end of the year video and talk about, like, my whole 2017, because a lot happened for me in 2017, and I was going to talk about my goals for 2018, and I was gonna even do some Christmas videos and stuff. None of that happened. I've just been really busy the last little while, and just have had a lot going on. I got some new lights with some of my Christmas money, so I'm still kind of experimenting, trying to figure out the best placement for them and like the best amount of light and everything like that. So there's kind of going to be some trial and error as far as that's concerned, but hopefully I did a good enough job for this first video, just kind of setting them up for the first time. So anyway, I had double incision top surgery with Dr. Garramone on October 10th, 2017, so I'm now 3 months post-op. And as I've done with the last couple of post-op videos, I'll go ahead and just show you my chest and then come back and give you more of an update on other stuff that I've noticed in my recovery. Here I am at 3 months post-op, and as I mentioned in my last video, I stopped taking spironolactone, so that's why I have a little bit of an acne breakout here, and I don't know if you can actually see it on the video, but there are some little tiny hairs here on my chest, which I'm not happy about, but anyway, that's what that is if you notice that. So my incisions are looking pretty good. This side is still the flatter of the two, but this one has smoothed out a little bit. They both have really kind of smoothed out and lightened a little bit since last month. Like if I run my thumb over this, I mean, I can feel that there is something there that I'm running over, but it's really pretty mild. There's not a whole lot of scar tissue underneath there. It's mostly kind of just what you see here, and then, you know, a little bit thicker under the skin. But for the most part, like especially right here, this is very smooth. The two ends, like here and here, have a little bit more kind of, I don't know, topography to them than the center part does. And on this side, it's the same way, but there just is still more in the center as well. Just a little bit more thickness and, I don't know, just kind of more going on here on this side. I do have this, this section of scar tissue here in the middle that I talked about last time. And when I come back to talk to you, not just showing my chest, I will give you an update on that because I did talk to Dr. Garramone about that again yesterday. That as well as this end, which is the tiniest bit of a little bit of a dog ear here. It's really very mild, but just compared to this side, which is pretty smooth on the end, you can kind of see, I don't know if I'm at the right angle, but you can kind of see how it comes out a little bit to a point there, and the skin is kind of being pulled that way a little bit. I don't know if it's showing up in the video, but anyway, I'll give you an update on that in just a second. The nipple grafts are also healing along nicely, and I'm getting a little bit more kind of pigmentation in them. Like you can kind of see it's like a little bit splotchy looking. And then the other thing is that I'm getting a tiny bit of nipple projection there. I don't know how much you can see it there, but it's still a very small amount, which I am actually happy about. I don't really want there to be much nipple projection because I previously had inverted nipples and I liked that, so I don't really want that to change too much, but we'll just see how that goes. So I think that's pretty much it for what I want to actually show you here, and I will come back and give you more of an update in just a second, but here is a final look at my chest at 3 months post-op. So as far as that scar tissue in the middle, when I talked to Dr. Garramone yesterday, he told me that what it probably is there are a lot of little blood vessels and capillaries and stuff in that area of your chest, and when they're doing the surgery, they have to tie those off in order so you don't bleed out, basically. And so when they do that, it kind of pulls the skin and like pulls the tissue together, and so a lot of times the scar tissue can kind of form thicker in that area. And it's very common, and a lot of times it's kind of like a marble kind of feeling, like there's this big kind of knot. Mine is less like a marble, it's more like an elongated kind of thing, but he said that it was the same kind of thing and that over time it should smooth out, and just to kind of keep an eye on it over the next few months, and that massaging it is fine. He said if I don't want to massage it, I don't have to, but it could help soften it, and basically just kind of keep an eye on it, and if that doesn't work, then we can revisit it, but he said that he wouldn't probably do anything about it until at least a year post-op. So basically I'm just supposed to keep an eye on it and just hope that it kind of smooths out on its own. And then the same thing with this little tiny dog ear on the side. He said just to massage that and it should go down over time. And while I was talking to him, I also asked him about the tissue that was removed, because I was really surprised on my my medical records that I got the pathology report, and on that it gives the amount of tissue that they sampled for the pathology study. And the full amount of tissue that they removed from me equaled about 1.7 pounds, which was way less than I thought it would be. I definitely thought I had more that I was carrying around there than 1.7 pounds. It does not sound like very much at all. So I was really surprised about that, and so I wanted to know if that was actually the full amount that was removed, and he said it was. So I was surprised about that, but he said that that was really common, that a lot of times people kind of think it's going to be more than it is or less than it is, and you just never know. But he said that usually it's not as much as you think it is, that when, like even when he's removing a lot of tissue, it seems like a lot, but then once they put it on the scale, it's really not very much weight-wise. So anyway, I just thought that was kind of interesting. I still don't have a whole lot of pain, which is good. I do have, every once in a while, I get little jabs of pain, or like little, I saw somebody online call them zaps of pain, just throughout my chest, and it's not like a regular thing, and it's not, they don't usually last for very long, but I'll just get these little tiny shooting pains, which I'm pretty sure is like the nerves reconnecting and just sensation coming back, and it's a normal part of healing. So it's not really a hindrance to me or anything, but that is something that I'm still experiencing. I pretty much have full mobility back. I'm able to raise my arms up all the way and like put them behind my head. Actually, like if I do that, I can feel a lot of stretching right here. And when I raise my arms up all the way, I can feel like it feels like I'm stretching something. And like there are times when I'm trying to reach something really high that I do kind of feel like it's a little bit difficult for me to do, but for the most part, I'm pretty much able to do like all my everyday activities. I'm back to working out pretty normally, except that I've lost so much of my progress that I can't really do a whole lot of stuff. So like I can't even do, actually I did one push-up the other day, and then like a couple days later I tried to do it and I couldn't do it at all. So that's where I am right now with push-ups, which is kind of annoying, but I'll get there. And after doing that stretching that I just showed you, I do have a little tiny bit of pain coming in just for a second here, and it's already gone. So that's just like to give you an idea of how the pain kind of comes and goes. I have actually been doing some stretches, particularly for the pec muscles, for both the major and minor pec muscles, which I will link a video in the description to where I found these exercises. And the reason that I wanted to do that, first of all, I did kind of want to loosen up my chest because in addition to doing the massaging of my incisions, I think that getting back to working out has helped kind of loosen things up and kind of soften things up, just because everything's not so kind of stagnant in that area. And I wanted to kind of stretch the middle part of my chest, especially because like when I move around, like this part of my chest is moving a lot, but this kind of is still kind of tight. So I realized that I was kind of still a little bit hunched over. And so after doing some research, I found out that a lot of the hunched over kind of posture comes from the pec muscles being too tight and not stretched out properly, which comes from, well, it can come from working out, like doing certain workouts, but in many cases, probably including mine, like almost definitely including mine, it's just because we spend so much time with our arms forward because we're at the computer all the time, or like, you know, doing stuff in front of us all the time. And that kind of trains your muscles to be in that position. And you need to like kind of rotate out and stretch these muscles in order to kind of like loosen them back up. So that's the exercises that I've been doing, and I will link those in the description, and maybe a card if I can do that as well, because it was a YouTube video that I found this on, and you can try that out. It's only like 2 exercises on each side that you do for like 30 to 45 seconds, so it doesn't take very long to do, and I don't know if it's helped me or not. Like I noticed that I still am kind of sitting in this hunched position because I'm so used to it, but whenever I think about it, I try to be conscious of it, and I try to sit up straighter and like pull my shoulders back because I just have gotten so used to like hunching over, partly because, like I said, just because of like my sedentary lifestyle, but also because I was so self-conscious about my chest that I did like hunch over to kind of hide it and stuff like that. So I'm trying to get used to being more like open and like have better posture basically. So I am massaging my scars once a day, and then I am also using I have actually switched to using Mepitech tape, and I have it around here somewhere. Found it. Instead of the Mepiform scar sheets, which I was taking the sheets and cutting them into strips, which worked fine, but I decided to switch to the tape because I just thought it would be easier, and it is. And I find these actually adhere better. So if you're choosing between the two, I would definitely get the tape. It's already, I got the 0.8 inches, which is 2 centimeter width size tape, which is pretty much perfect for my incisions. And the good thing about it is it's just this tape, so you can actually cut it to whatever length you need it to be. I do about 7 1/4 to 7.5 inches on each side. I actually made one side a little bit longer than the other because the incision is a little bit longer on my left side, just like a tiny bit. But then you just kind of put it on your incision and just leave it there. So what I do is I take them off and wash them and just set them aside to dry. Massage my scars, take my shower, and then I usually wait like, I don't know, an hour or something like that for them to continue drying. And then I'll come back and put them on and then just wear them for the rest of the day and overnight until the next day when I do the same thing all over again. So I do sleep in them and I exercise in them and do pretty much everything else other than shower, and then that one like hour in between where I'm waiting for them to dry. So I think that's about it for this update, and I still do feel like I'm in recovery. I still feel like there's like healing going on, but for the most part I feel like I'm pretty much back to my normal life and like not really hindered by having had surgery too much anymore. And I'm really super happy with my results, even with this little scar tissue issue that I've got going on. Other than that, like even with that, I'm super happy about the aesthetic of my results, as well as like how I'm doing and how I've been healing and just how everything has gone in the whole process. And yeah, so I'm really ecstatic about that. As always, you can ask any questions in the comments below, and if you like this video, give it a thumbs up and subscribe to see more of my future content. Thanks so much for watching, and I'll see you guys next time.